Africa Health Care Network was launched in 2015 with the goal of creating the largest provider of renal care and dialysis services across East Africa and more broadly in the future across sub-Saharan Africa. We provide care to patients suffering from chronic kidney disease, known as CKD, to help them through the progression of chronic kidney disease to end-stage renal disease, which then requires dialysis, primarily hemodialysis, and that is the filtration of blood from the human body for patients whose kidneys have stopped working. If you look at the total populations of these three countries, you're looking at approximately 120 million plus people. Cumulative, there are approximately 5,000 patients currently receiving treatment. So there's a huge gap between the patient population that requires dialysis and those that are actually receiving it. We started in 2015 with myself and our other co-founder, Dr. Lloyd Vincent. We opened our first dialysis center in the capital city of Kigali, and then through two public-private partnerships, we expanded into Tanzania in 2017. Again, working with the government in partnership and also working with faith-based hospitals, we began our expansion into Kenya. Currently, we have about 28 centers across East Africa. One key element that we saw when we first started out was that most dialysis centers were concentrated in the capital cities. And so for us, we decided we were going to bring the care to the patient. So bringing access through regional access, we set up dialysis centers across East Africa in regions where no one else is willing to go, and thus have, over the past 6.5 years, established the largest presence across the region. So if you look at Tanzania right now, over 60,000 patients would require dialysis today. Currently in country, about 1,500 patients are actually receiving care. And so for that reason, we have been able to open 10, 15 centers outside of the economic capital in Dar es Salaam, such that patients who previously did not even know about the disease are now able to access care.
The impact that AHN has to the local community is huge. Dialysis centers are distributed across the country, and therefore people have better access to the services that are close to the areas where they live. Another impact is through price. Most of the patients can afford to do their dialysis at least 3 times a week. And another impact is transfer of knowledge. Nephrology is quite new in this country. AHN is bringing new knowledge. The nurses that are trained to do the dialysis, they are from the local communities. Therefore, they will be working at the dialysis centers and again transfer the knowledge that have acquired at AHN, to other centers as well.
Key component of Africa Healthcare Network is access, affordability, and awareness. We aspire to be the lowest cost provider while providing the highest quality of care to patients. We have an extremely high focus on patient care and patient clinical outcomes, whereby we have rigorous training, we have a rigorous focus on clinical operations, on our KPIs, and then also ensuring that patients who require follow-ups are seeing the right clinicians.
What patients say about AHN is that AHN offers high-quality standards, affordable services, and best level of healthcare in the country. Here at AHN, it's different because we have high-quality equipment and also we have very professional staff.
AHN has brought a new way of doing dialysis. And we have seen even other centers and other stakeholders are learning from AHN, and which is a good thing in terms of the way we do our dialysis, our protocols, procedures. So it's going to change the way we practice our nephrology in this country.
AHN started in 2015 with 1 center. By end of 2020, we had about 14 centers with a goal to 2022 to be operating about 40 centers. And I think in the longer term, next 5 to 10 years, we hope to enter into West Africa and continue our expansion there. I really hope as we continue to grow our organization, our team, and our clinical operations, we will continue to make a difference and a positive impact in the healthcare ecosystem.